Any county employee that's ever been sitting across from one of our customers has had that feeling where, I wish I could do more. I wish I could help this person more. But because the way the system was built was such that it was program by program, the only help I could provide in many ways was just the piece of the pie that I had. And so a lot of us have felt frustrated for a long time about that inability to connect persons to other services. Maybe we could give a phone number, maybe we could give a website or directions to another office, but we knew that that wasn't enough, that wasn't good enough. In the future, once RivCoONE becomes the mindset for everybody, the idea is that every employee, when they're working with a constituent, a member of the public, a resident, a business owner, that they're able to really make sure that there's no wrong door. That once they're sitting down with somebody in front of them, and whether they're sitting down in person or virtually or on the phone, that they're able to connect them to really any service that the county offers. The idea is that through collaboration, through communication, through a single intake form, through data sharing, that we're able to provide those needs and all of the services in one setting. Thereby, it's easier for the resident to access those services and to have a better life. Early on, when we had our first pilot project set up at the Jurupa Valley Clinic, we were hearing stories of people who came in to see us, people who worked with our community health workers, people who got access to the RivCoONE services, were so excited about how it unlocked services for them that they went out into the lobby and were calling their family and friends. And they said, quick, get down here, the county's giving away services. Well, of course, we want to give away the services. That's why we get the money from the state and federal government, from our local taxes. So we're interested in doing that, and the fact that our residents were realizing that we wanted to do that was huge. From a data-driven perspective, we've had a number of different economists, a number of different experts look at the outcomes. And what we can show demonstrably is that the outcomes of those individuals who have been through our RivCoONE pilots is better than those who have not yet had a chance to experience it. So when we look at the whole person health score coming out of our clinics, the higher whole person health scores are coming out of those clinics where we've been doing RivCoONE for months, if not years. Good health is really the key that unlocks the quality of life. We know that when you're healthy, you're not worried about when you're going to get your medicine, how you're going to pay for it. When you're mobile, you get to access and have more fun doing other things. Currently, RivCoONE has a number of pilot projects, a number of pilot sites. We have 31 physical locations currently set up right now. Certainly we want to, as again, make every employee their own open door. So right now we've had probably about 1,000 to 2,000 employees engage in the system, and each one of them became a fan of the program and are talking about it to their colleagues. So the idea is, once you're in it, once you've experienced it, once you've seen the positive outcomes for our residents, you're a believer and you want to figure out a way to scale it. It's the folks who haven't been there yet that are still a little hesitant to try and figure out, is this thing just more work to do or a different, better way to do it? As somebody who's already been through the process and has become engaged in, I think that's really going to be a big factor. Anything that I could say, anything that a department head can say certainly will carry some weight, but it's the good people doing the good work that are really going to be the best messengers for RivCoONE and spreading it across all of county departments and services.